Alright, here's where we left off for part 2 of the renal disorders. And what I just wanted to mention quickly was that you have a list here of the issues that's going on with the glomerular disorders, with the disorders that cause damage in the kidney. Alright, so what this damage eventually leads to is ischemia, a lack of blood flow to the kidney, and then eventually you have death of the kidney, complete lack of function, and for the person, that could eventually lead to death. So, points 3, 4, and 5 here are specifically related to Objective 6 in your list of objectives. Alright, so glomerulonephritis is just simply an inflammation of the glomeruli. Symptoms are going to be hematuria, proteinuria, oleuria, edema, and hypertension. Glomerulonephritis is a group of diseases of the glomeruli that are caused by a variety of factors. These can be classified as primary or secondary. Primary causes would be immunological disorders, drugs or toxins, vascular disorders, and then just outright ischemia. Secondary causes would be systemic diseases such as lupus or diabetes. So the overall result of this inflammation, if it is left unchecked, if it is so extreme, would be cell damage and no longer functioning. And something to make note of is this mechanism of injury. Alright, how do you have inflammation that occurs within the glomeruli? Alright, that causes this inflammation here. Well, there's 3 main mechanisms of injury. You can have deposition of circulating antibody-antigen complexes. So remember, this could be because there's a bacteria infection. This can follow a bacterial infection, where you have the bacterial antigen, your immune system is trying to clear it, there's antibodies that have been produced against that antigen, and then you have that complex that develops. The antibody binds to the antigen. Remember, the antibody has 2 antigen binding sites, so then the one antibody can bind to 2 bacteria or 2 antigens, and you can develop these very large complexes, large in terms of the microscopic scale. Alright, you can also develop antibodies against the glomerular basement membrane. So these would be basically autoantibodies. And then the antibodies come in and bind to that basement membrane, and it elicits the inflammatory response, sometimes with complement. Alright, so then you have inflammation. Alright, non-immune mechanisms, something outside of the immune system. There could be drugs, toxins, ischemia, that are going to induce the inflammation response. Alright, so the different mechanisms of injury here. Alright, you can see the damage to these kidneys, and this is a nice flow diagram of the problems initially. So circulating immune complexes, circulating antibodies to the glomerular basement membrane. Alright, all of those are going to elicit an immune response. Here you have complement activation. That brings neutrophils in. Here you have podocyte injury and proteinuria. Alright, the podocytes are the epithelial cells above the basement membrane. With this initial injury or mechanism, you have proliferation of macrophages. Alright, then you have release of oxidants, proteases, cytokines, leukocytes, growth factors. All of these are going to elicit damage to the glomerular epithelial cells. You have increased permeability, loss of that negative charge, so then the proteins can leave, developing proteinuria, hematuria, glomerular sclerosis, interstitial fibrosis. This leads to the decreased glomerular blood flow and therefore the decreased filtration rate, and then you have renal failure. So glomerular disorders can be classified according to how severe they are, and you can develop what's called nephrotic syndrome, produced by a number of different types of renal diseases. All right, this is going to be characterized by large amounts of protein loss in the urine. Person will develop severe edema due to the low plasma proteins. And risks for this, drugs, infections, vascular disorders, diabetes, everything that you would have as a risk factor for the glomerular nephritis. This is actually most common in children, but in children, this nephrotic syndrome causes minimal glomerular change. So the children's kidneys, the young kidneys, can recover. However, with adults, the manifestations generally indicate more severe renal disease, and it's progressive, so therefore the damage is not always corrected. And you have scar tissue that develops sclerosis. So then to treat, generally you'll do this by diet. All right, decrease the salt and fat content. You can have diuretics and steroids, and generally a normal protein diet, even though you are having large amounts of protein lost in the urine. So here's just a flow diagram of this. Nephrotic syndrome, altered glomerular permeability, loss of negative charge, so you have increased filtration of plasma protein in the urine. That leads to low protein in the blood, so you have edema. The liver gets activated to synthesize lipoproteins, and then you have hyperlipoproteinemia, high lipids in the urine. So with this proteinuria, you have loss of transport proteins. All right, decreased thyroxine. All right, so now you're playing with the thyroid and your overall metabolism. There's decreased vitamin D activation because this is going to occur in the kidneys, and the kidneys are having issues at the time. And then you can also be more susceptible to infections because even though a major protein that's being dumped into the urine is albumin, you can also lose your immunoglobulins. All right, now, acute kidney injury, intrarenal, postrenal, and prerenal. This is going to be discussed in the video, so I'm going to just skip over this. Here you have acute kidney injury, sometimes just referred to as AKI, and up here ischemia or the nephrotoxins. So this is going to cause injury, right? Possible glomerular injury, tubular injury, decreased permeability, decreased surface area, down here decreased glomerular filtration rate, and a lack of urine. All right, same over here with tubular injury. You have cellular cast formation, which is just a fibrosis activity. That leads to obstruction. The obstruction leads to increased intraluminal pressure, decreasing the filtration rate and decreasing urine production. All right, so with acute kidney injury, all right, there is an initiation phase where you have kidney injury is evolving, it is starting. And at this point, if you stop that initiation phase, whatever the problem is, if it's ischemia, you add blood, you add oxygen, and you get oxygen back to the kidney, you can actually prevent injury from happening. All right, then there is the maintenance phase, established kidney injury and dysfunction. Urine output is low at this point. Then the recovery phase. All right, hopefully the injury is repaired and you have normal renal function established. Diuresis is common, decline in serum creatinine and urea because the kidneys are functioning properly. right? But then you can lead to, or develop chronic kidney disease. And this is just simply going to be a progressive loss of renal function, and eventually it will start to affect all organ systems. Associated with extended or chronic hypertension, diabetes, intrinsic kidney disease, something going on specifically with the kidneys. And this is going to be at a variety of stages, right? Normal, your glomerular filtration rate is 90 mils per minute, but then you have mild, moderate, severe, and end stage, where you see the decrease in the glomerular filtration rate. Alright, so with chronic kidney disease, you just see this nice flow diagram. These flow diagrams are great. They sometimes overlap in content, which repetitiveness is alright in this manner, or in this case. So you have renal injury. That causes loss of nephrons. Alright, then that causes or results in an increase in the angiotensin II release. Alright, loss of nephrons gives you a glomerular capillary hypertension. The glomerular permeability and filtration increases in terms of putting protein in the urine. You have increased tubular protein reabsorption, tubulointerstitial inflammation, fibrosis, renal scarring. That leads to systemic hypertension, which leads to glomerular capillary hypertension. Alright, the renal scarring leads to the loss of the nephrons. So you see how once this renal injury activity starts, you get this negative cycle, so to speak. Alright, so again, with the chronic kidney disease, you have protein in the blood, and uremia, simply because of the glomerular hyperfiltration damages to the interstitial tissue of the kidney. Alright, and then your body simply cannot filter. Alright, so the urea is not filtered, urea builds up in the blood, plasma creatinine levels increase. Fluid and electrolyte balance, or imbalance, so to speak. Sodium excretion increases with obligatory water excretion, leading to sodium deficit and volume loss. So the concentration and the dilution ability of the kidney diminishes. There's an issue with potassium balances, and then leading to acid-base balances. Metabolic acidosis will develop when the glomerular filtration rates drops to the 30 to 40% mark, which you're probably at the moderate stage of chronic kidney disease. Alright, then you have calcium issues, phosphate issues. Those are going to be pulled from the bone. So then you have issues with fractures, issues with protein and carbohydrate, fat metabolism, and anemia. Alright, because erythropoietin is going to be produced by the kidneys, and the kidneys are not functioning. So you have the issues of anemia, lethargy, dizziness, and then a low hematocrit, because those new red blood cells are not being produced. Alright, this is a slide that is not in your slides, but just some 30 seconds on treatment options. Alright, in some cases where you have kidney diseases, you may not have to do anything initially in terms of treating the symptoms, but rather severe restrictions for diet, fluid, to try to maintain renal function as long as possible. Alright, then there's hemodialysis, peritoneal dialysis, and then transplant. And with kidney issues, if you don't do anything, then of course that will lead to